Welcome to Thoughtful Transformations, the therapy toolbox, where we break down key psychological concepts to help you better understand mental health and personal growth. Today, we're diving into an important yet often misunderstood part of therapy, the process of diagnosing patients. When people think about mental health diagnoses, they often imagine a quick checklist or a therapist making an instant judgment. In reality, diagnosing a patient is a careful, multi-step process that involves gathering information, assessing patterns, and ensuring accuracy. A diagnosis isn't just a label, it's a tool that guides treatment, helps clients understand their experiences, and provides a roadmap for healing. Step 1. The initial assessment. The process begins with an initial assessment, which usually takes place during the first few sessions. This is when the therapist gathers as much relevant information as possible about the client's history, current struggles, and overall mental health. During this phase, therapists explore key areas such as 1. The client's presenting concerns, what brought them to therapy. 2. Emotional, cognitive, and behavioral patterns. 3. Medical and psychiatric history. 4. Family dynamics and early childhood experiences. 5. Trauma history and major life events. 6. Social, occupational, and relational functioning. The goal here isn't to rush into a diagnosis but to understand the bigger picture. Mental health conditions often have overlapping symptoms, so taking time to collect detailed information helps avoid misdiagnosis. Step 2. Clinical observation and behavioral patterns. A diagnosis isn't just based on what a client says, it's also about what a therapist observes. Body language, tone of voice, emotional regulation, and thought patterns all provide valuable clues. For example, someone experiencing major depressive disorder might describe persistent sadness, fatigue, and loss of interest in activities. But a therapist also looks at nonverbal cues. Do they have a flat affect? Do they struggle to concentrate? Do they exhibit slowed speech or movement? These observations help piece together the most accurate clinical picture. Step 3. Screening tools and psychological testing. While conversation and observation are crucial, therapists often use standardized screening tools to support their assessment. These can include 1. Questionnaires like the PHQ-9 for depression or the GAD-7 for anxiety. 2. Personality assessments such as the MMPI-2. 3. Cognitive tests to assess memory, attention, and executive functioning. 4. Trauma screenings and dissociation scales. These tools don't replace clinical judgment, but they provide measurable data to support a diagnosis and track progress over time. Step 4. Differential diagnosis. One of the most important steps in diagnosing is differentiating between disorders that share similar symptoms. Mental health conditions are complex and many overlap. A person struggling with excessive worry could have generalized anxiety disorder, but they might also be experiencing obsessive-compulsive disorder, PTSD, or even an underlying medical condition contributing to their distress. Therapists use the DSM-5, the Diagnostic and Statistical Manual of Mental Disorders, as a reference guide, but diagnosis isn't about checking off boxes. It's about understanding how symptoms interact in a person's life, what underlying factors contribute to their struggles, and what diagnosis will be most helpful in guiding treatment. Step 5. Collaborating with clients and adjusting over time. A diagnosis is not a life sentence, it's a working hypothesis that can evolve. Mental health is fluid, and as therapy progresses, new insights emerge. Some clients may have been misdiagnosed in the past, and part of the therapeutic process involves reassessing and refining that diagnosis based on new information. Therapists also ensure that clients understand their diagnosis in a way that empowers them rather than defining them. Labels can be helpful for understanding struggles, but they should never feel like limitations. The real purpose of a diagnosis is to create a personalized treatment plan that helps clients heal, grow, and move forward. Final thoughts. Diagnosing patients as a therapist is a careful, intentional process. It requires deep listening, critical thinking, and an understanding of the unique human experience behind the symptoms. A good therapist doesn't just assign a diagnosis, they help clients make sense of their experiences and use that knowledge to foster real change. If you found this video helpful, don't forget to like and subscribe for more insights from Thoughtful Transformations. Let me know in the comments, what are your thoughts on mental health diagnoses? Have you had experiences where a diagnosis helped or even hindered your healing process? Let's start a conversation. See you in the next video.